they yeah, but if they want to know that it's coming in, so that they can make sure that they calculate and stuff. Yeah. Sorry, I just can't email them. Yep. First piece coming. Second one's about to come in now. Yeah.
So I'll just tell them to
Yeah.
report
It's such a big deal.
There we go. Can you see my mic signal?
Sorry, hey, I've finished the tech thing, but we go to
Cool. I'm ready as well. If you guys go, just let me know and I can email you it.
so whether they want to stop and redo it.
Right, so we're
They try and keep rolling on it.
They're the same things as yesterday.
Eight, 19. Fairly beloved.
Switch one on.
heads up quickly that we might run over the hour so with a few health questions. But so we've got Dr. Kevin Snee, Dr. David Sinclair, and Dr. Andrew Burns.
I'm sorry, I can't hear.
Sorry, Dr. Kevin Snee, Dr. David Sinclair, who's a medical officer of health, and Dr. Andrew Burns, who's an infectious disease specialist.
Sorry, and who was the last name?
Andrew Burns is an infectious disease specialist.
Thank you.
Okay.
Okay, so this morning we'll just do the general overview as we've done all along, and then we'll do some health-related, some specific health questions for you, and then it'll be followed by the HDC as we've done normally. Okay, but just the heads up that you might run over a little time.
Okay, good morning everybody and welcome. And I think the overall message for today is that we're seeing, as we anticipated, the numbers of new cases decline and the pressure on the health system decline. So hospital pretty much back to business as usual. And in terms of the some of the numbers, we have revised upwards the estimate of people affected. So we're now, from the community survey, we're now looking at 4,100. And in terms of the compiler back to notifications, we've got 106 confirmed and 334 probable, so that's 440. But obviously then there are likely to be a small proportion of the total. In terms of the hospital status, I say the hospital is working well, and we have 15 patients on the general wards. We have 2 patients in ICU. One of those, who have symptoms of diarrhoea and vomiting. One of those is on there for other conditions, not just for diarrhoea and vomiting. Since midnight, there have been no attendances at ED, which is a good sign. And we're seeing in aged residential care a reduction in symptoms with clients with symptoms, and in general practice we're seeing a reduction in demand on the service. Likewise for St John's, for Healthline, for pharmacy. So that's all a good sign. So again, the message again is that the outbreak of Campylobacter is coming under control and is very much on the decline. And what we'd like to share with you now, we have copies of this, and I wonder whether we could hand them out. There's a few graphs here that you may find helpful. One is the data from the survey and from the confirmed cases at a point in time. And I know there have been a number of questions. There have been a number of questions about when did it start, because there are some cases that we're all aware of, including my own son, who started, who appear to have the condition, but actually appear to have started before we might have expected. What does that mean in terms of when do we know that the outbreak started? And what you can see from this graph, and David will talk you through it, is on or around the 8th of August, we're pretty confident that the outbreak starting then. Possibly before then, but certainly by then. So that suggests that any contamination must have occurred before then. So by the Monday, the outbreak is beginning. And then if you turn over the page, you can see the activity at emergency department, and you can see that on the Friday we're starting to see an increase in the number of cases, and then a significant increase on the Saturday. So you can see it starting, becoming noticeable at the hospital late on Friday and Saturday. And then in terms of the figure 3, you can see data from schools, and again you can see things starting to take off on the Friday. So when we were putting all these bits of information together and recognising that there may be a problem. So David, I wonder if you could particularly talking through figure 1 and what that actually means.
Am I audible with these ones? Or? You're the great
Shall we move across?
Yeah.
on our website.
Sure. Okay. Right. This is essentially a very typical epidemic curve. As I was explaining yesterday, that this chart shows when people's onset date of symptoms was. Now these are retrospective, so people are being asked generally several days afterwards when they remember getting sick. So that can be a little inaccurate. But as you can see, a steep incline certainly from Monday. There's a couple of, or 3 people there, it looks like, who thought their symptoms started on the weekend. That's more difficult to assess, either because people not quite remembering where they were or what they were doing on those days, but that will be certainly from the Monday is when we're thinking that's the most likely days for most people starting to get ill, and then through to Friday. You'll see the peak is on Friday when the chlorination started, but remembering those people had already been infected at least 2 to 5 days beforehand. So these, even at the peak, you're not talking about people getting exposed then, you're talking about people getting ill then. So their exposure on Friday would have been sometime significantly earlier in the week. You can see then the peak falling off, and certainly after the first day or 2 you can attribute that to the chlorination of the water. We don't know what would have happened if the chlorination happened. It would have continued to go up for a while, until basically everybody who was susceptible at the time was getting ill. So certainly the chlorination is what is timely, needed to happen then. It also just emphasises that, as I was talking about yesterday, the time period that it takes from infection or exposure through to symptoms, then people having a couple of days then of feeling grotty but not going to their GPs, and then the following day when they get those proportions who get the samples taken, those samples coming back, which is the official notification that we get in public health services, may be the first indication that anything's happening, if you like, from through the routine surveillance systems. Anything else, anything earlier would have had to have come through earlier, and from informal networks or people ringing up, and it doesn't seem to have happened. So, as I was saying yesterday, this is not atypical that there is these delays of several days from an event to being able to be picked up in our surveillance systems.
Are you able to say what day the exposure happened?
Well, we have to go back to when those first cases came through. And in general, you would say those first cases are people who've had the shorter incubation periods. So you are looking at sometime maybe over the weekend.
So around the 1st?
No. Around, well, this is 2 to 5 day incubation period. Can be shorter, can be longer. So you would be thinking around exposure around about the 6th, 7th, maybe the 5th.
And that fits in with the period of heavy rain, doesn't it?
It does, well, except that, well, just looking at the chart here, the heavy rain is really on the 5th and 6th. So it's already underway. So this is something we have to work through still.
Yeah, does that mean it could have gone into the system before that heavy
Well,
rain event, and doesn't that then change
well,
what
it's
everyone's been thinking?
when you talk with the district council people, they're much more up to date about their assessment of when things happen, but there are still several possible sources which have been they're working through identifying. Whether it was the rain or something else, it's still to be worked through. We've still got some results coming back. hopefully later today and into early next week, which will help inform that.
I think in any investigation it pays to keep an open mind. Whilst the heavy rain, you may or may not have noticed, we put that on the chart. It's a second graph underneath the main graph. So you can see when the heaviest rain was on the Sunday. And I just think we need to keep an open mind and not just assume and go straight for the obvious cause, because it might be something else.
Do you think a medical emergency should have been called?
A medical, well, in a sense, we did on when we identified the problem particularly on the Saturday, when it became manifest that there was a very substantial problem, more than the suspicions that we had on the Friday. So, we've been running a major incident ever since then.
But I guess should the government have done more in that sense to do that, or?
Well, I think in terms of managing the incident, we've been we've been coping pretty well, and as I say, we've had good support in good working out in the community. We've had and working with aged residential care, that's protected the hospital, which has run pretty well over the course of the event. So that the health service has not been overwhelmed in this. I think that's important to note. There were a couple of other things that I wanted to
Sorry, could you please speak up? It's very hard to hear.
We'll do our best. A couple of other things I just wanted to comment on. You may be aware, a number of you have asked me about the patient that died, and I'm just alerting you to a media statement from the coroner. So we have passed the case to the coroner, so if you look at the statement, essentially what it says is that so it confirms that the test result, there is a test result for the 89-year-old who died in Havelock North, that she had contracted Campylobacter, and there will be a further examination of the case, but it also confirms that there were other significant underlying health issues, and so the Campylobacter may have been coincidental and not the cause of death, and that remains to be determined. So that's something I just wanted to alert you to, because I know a number of you have asked me for that information. And if you want to know any more about that, it's really a matter for the coroner. The last thing I wanted to say is that we are conscious that whilst the major health emergency that we've had for Campylobacter in Hawke's Bay is now starting to decline, there are potential relatively unusual complications that can come about as a consequence of Campylobacter, and we are making sure that our clinicians are properly briefed both in the hospital and in primary care about what to look for and how to manage those conditions, and we're working closely with the Ministry of Health. I think it's just important that the public, if either you're not getting better from Campylobacter or you start to become unwell again, you get in touch with a general practitioner or make contact with Healthline and just bring it to our attention so it can be dealt with.
What are those complications? So we can get that message out to people. What sort of things should people be looking out for?
So, Andrew, would you like to do that?
Thank you.
Yeah, I think first of all, it's important to stress that these complications are very rare, really, but we do expect to see a few of them. The first one, which is most likely to be seen, is a condition that affects your joints. It's known as a reactive arthritis. This is likely to be seen in a few tens of people who've been affected by Campylobacter. It's hard to be sure exactly how many we will see in this current outbreak, but it may be between 10, 20, or even up to 40 perhaps, of folk may develop some joint symptoms in the next few weeks. Important to emphasize that these symptoms can usually be managed by general practitioners in the community, and in a few cases they may need to access our specialists in the hospital. It's also important to emphasise that the joint symptoms almost always resolve over a period of some weeks or months. The second condition that is associated with Campylobacter is much rarer than that, and it's known as Guillain-Barré syndrome. This is a neurological condition which is very rare. It has been, though, reported associated with Campylobacter, and it really will present, if it does present in anyone in Havelock North, the symptoms really include some tingling in the feet or fingers and hands, followed by some weakness. Whether we see any cases is really uncertain. This is rare enough that in other outbreaks of Campylobacter of this size, it hasn't always shown itself. But we are preparing for the possibility that there may be some people out there who have been affected by Campylobacter who may develop this condition. So in preparation for that, we have actually spent the last few days making our clinicians in the hospital, especially the ED staff and the physicians aware and paediatricians aware of this, the fact that there may be a case coming through in the next few weeks. And we've also tried to heighten the awareness amongst our general practitioners and also the registered nurses in the rest homes and the boarding schools about what to look out for. I'm sure that there will be questions as to how many we might expect to see. And the answer to that really is anywhere from none to a couple would be, I think, an honest, truthful answer.
Okay. So we're gearing up for all eventualities here. I think that finally for me, I think it's important that people continue with the measures that we put in place, the boiled water in Havelock. It doesn't seem to me that that's important to continue in Hastings, but it's important to continue in Havelock for the time being. And as I say, the measures that we've taken to date are bringing the situation from a health outbreak control under control, and we're seeing a decline in cases. And over the next few days, we really expect to see the health system getting back into business as usual. So I'm happy now to.
This might be a question for the council, but is there any idea of this bacterial testing where the source potentially come from?
I think that I don't believe so, but that'll be a question for the council.
And also, just while you're still here, have you spoken to the family of the woman who died, or do you plan to speak with them?
I haven't spoken to that. That matter is very much with the coroner at the moment, but I haven't spoken to the lady.
Do you think the family deserve an apology or some kind of contact given?
Well, I think we need to review that, but I don't have any plans at the moment. Yeah, on it.
Oh, no.
Okay.
Could I just need to run, so to make sure that those figures right, those figures you read out right at the beginning, could you run those through again?
Sure. So they were the 28% of people in Havelock, 4,121. 54% of households, that's 2,364. The confirmed Campylobacter notifications, 106. Probable 334, that's a total of 440. Ward, in the hospital there's 17 patients, of which 2 are in ICU. I think those are the main ones already.
2 in ICU, did you say?
Yeah, so there's one there's a new patient in ICU, but that is a lot to do with other symptoms, not just the diarrhea and vomiting.
I spoke to someone yesterday in Havelock North. They haven't actually been telephoned yet in this survey. Are you confident they
It's
are
not.
getting round?
It's a sample. It's a sample.
Oh, so you're not ringing
Not
everyone?
ringing everybody. So it's just a sample, and then you can extrapolate for the whole population. Yeah, and that's been repeated.
There's a sort of ongoing sample, and also the schools are also doing their own monitoring through, some of them through SurveyMonkey, etc., on the numbers of children who are sick. That'll be important, particularly for return to school for primary schools on Monday. This is sort of an ongoing situation. And the pattern there is it's declining for children as well, so it's as expected. So yeah, that's all good. That's all encouraging.
So it's coming under control. Thank you.
Excuse me, sorry. Just for those of us on the phone and can't see you, could you please tell us who spoke in which order? Apologies.
With the Kiwi accent? Yeah. And then there was Andrew Burns with the South African accent.
Brilliant. Thank
you. Is the best type of support we could offer. But simply put, we're actually going to use some ratepayers' cash to actually help these businesses. The quantum, how and when is undecided, but I get the fact that insurance-based products or long-term insurance resolution of this, if somebody can be found negligent, will take months. These businesses don't have months, they need support now.
The ratepayers, though, they are the community, so surely some government assistance would help.
Well, any assistance from the government would help, and you know there are conversations around that going on, but the government actually hasn't met as a cabinet to make those sort of decisions. All I'm signalling is some other ratepayers in the Hastings district are going to have to support this Havelock North community. Sophie.
Bringing it back to the say, Bradshaw, has he breached code of conduct?
I haven't looked at that. To be honest, there is a code of conduct process. It is difficult, doesn't result in anything. I'm actually not interested in that from that perspective. What I'm saying is, he is a governor of this organisation. If he has some material that is germane to the investigation, he should give it to us, as we all work to try and find out what's happened here. Holding on to material, if he has some, is actually, in my view, a very irresponsible thing to do from a governor or an organisation that is in a situation like this. Simon.
On Hastings chlorination issue, what's the council thinking on that?
We intend to leave the chlorination in Hastings for the immediate future anyway, only because while we're really confident that everything's okay, we just don't want to take any risk in the short term. People have generally been receptive. I've been and had my hair cut this morning, and I said, can you smell the water? No. Could you detect it in the towels? No. So actually, most of the feedback, has been, while they don't like it, they understand why we're doing it. And I'm just delighted that actually, particularly for those people that have drunk water in that tanker in Havelock North, that the water was perfectly safe.
Is it still a precaution Hastings people boil their water?
No, they don't need to boil their water anymore. And Hastings only. Havelock North people do need to remain boiling their water.
I did notice that the boiler in front of the gallery has been shut down.
Yeah, that's because that's a direct feed. Can you explain that?
So which bores are
the fluoride one, the one. Yeah.
Oh yes. So the fluoride taps that we have there, they were put in place because there are members in the community that wanted to access fluoride-free water. So that water comes fundamentally at the borehead, downstream of where the chlorine is being, or usually fluoride, but where the chlorine is now being dosed. So that's not chlorinated, that part of the system at the borehead. So we've had to shut those taps down. I guess the good news is that the whole of the community is drinking fluoride-free water at the moment.
Just back to that business assistance package, that $10,000, what will that specifically go on?
But we will probably give that to the Havelock North Business Association to work out an advertising campaign. I mean, we're going to talk to them to say, what they need. But what I'm trying to say is we get the fact that actually the place has been deserted all week. It's been costly on them. It's difficult for them to get compensation from insurance because a civil defence emergency hasn't been called. And we're trying to provide some significant interim help, which is not too complex, not full of bureaucracy, but actually will help those businesses. Now, we're going to be talking with those businesses over the next 3 days, or 2 or 3 days, to try and say what is an appropriate way of doing that. But what I'm signalling today is the council has decided that it is going to try and help the businesses out there where it can.
What do you say to the insurance companies about the fact that people have been left in this position?
Well, we might also have a conversation with the insurance companies to say, is there a goodwill factor that they can bring in here to actually help this community at this time?
Is there a precedent for a civil emergency locally being involved in the community when there is an emergency declared?
For the welfare side? Yes. I can't think of one, Patrick. We may have one, but in simple terms, we have a properly set up welfare system with the Red Cross, Civil Defence and staff of a number of councils. We decided to mobilise it. It's working very, very well, and and actually the people are loving what they're doing. You know, it gives them an opportunity to operate in a different time than a major earthquake or flood event, and they're doing great work.
What's the cost to ratepayers of this so far, do you think? Any idea?
No, I have no idea. There will be normal staff time, and our staff are working incredibly hard. But the cost so far is quite minimal, but there will be some substantive costs, particularly when we get into support for business interruption and that type of thing.
So how big would that package be?
I can't, no, not really at this stage.
Said it's going to run into the millions.
No, I'm not actually going to comment on the amount. That is, we're trying to talk to the businesses in the next few days. We're going to go back to the council next week with a sort of what are the options and how might this be done. I don't want to comment on a number, but you know, we are genuine in our attempts to try and help.
Would you like to work with central government on perhaps seeing if they could put some money into that as well?
Yes, that would be very welcomed.
Where are you at with the test results for cryptosporidium? This is why we're still boiling the water, so you obviously don't know whether crypto's in there as well.
So we aren't testing for cryptosporidium in the water supply. That comes through the cases that present, and the DHB would be compiling that information.
But why are we still boiling the water, sorry? Because
so we're still boiling the water because until we can absolutely confirm that there aren't other bugs in there, because we still have a low level of bugs in that water supply, then there could be other bugs there. Now, chlorine is effective at killing Campylobacter and a vast range of bugs. Cryptosporidium is resistant to chlorine, so that is why you have the boil water notice on top until you can actually confirm that cryptosporidium is not an issue.
Right, and when do you hope to do that?
I think it's, I'm not sure in terms of the timeframes for cryptosporidiosis to then start presenting in cases, but again, that's information for the DHB, they can provide that.
What are the bacteria levels on private bores in the vicinity of Brookvale Road?
In terms of private bores, we don't actually test private bores, so we've had a number of inquiries from private bore owners about testing. So we've advised them to either contact the local laboratories that are available or seek advice from the Hawke's Bay Regional Council.
Is it one or both bores that are still showing bacteria?
Both bores are showing a level of bacteria. 2 days ago, bore number 2 was clear. So it just represents that there are, I guess, patches within the aquifer where at times as the water's moving through, it's clear when we take the sample, and then it's coming back again.
And
how many
E. coli?
Sorry, yeah, we're still testing for E. coli. Yeah.
Are you concerned about film on the pipes, and are you concerned about pockets within the aquifer where the chlorine's not reaching?
So we're not chlorinating the aquifer.
Okay, just the reservoir.
So we're just chlorinating all of the pipes and the reservoirs and everything in the reticulation.
Okay.
In terms of pipes and what did you say?
Yeah, so film building up on the pipes.
So in terms of film building up on the pipes, chlorination deals with that. It's given the clarity of the water that has been pumped through that system for so many years. That type of water, you get very rarely do you get any build-ups on the pipes like you do with the surface water.
New information for you and the Tonkin and Taylor report?
Any new information?
Tonkin and Taylor report.
So, well, I think what we said before is that the report was inconclusive in terms of what it said, and that we had to take a wider view at everything.
Did you read anything that you didn't know? New information for you?
Well, I think we took the position of we could have a look at it internally ourselves, but we didn't have the level of expertise to be able to undertake a proper survey, and that's why we engaged consultants that were trained in those sorts of techniques to undertake that work to provide us with the information that then we can act on.
Given that,
sorry?
When was it commissioned?
It was commissioned in December of last year.
so given that that report has taken several months and it's inconclusive, how hopeful are you that the investigation into the other two bores is going to reveal what happened?
I think we need to be clear about the investigation. Clearly we know there is something, and Campylobacter we now know, is in the other two bores. We are taking a completely open and wide-ranging perspective on how those two bores could have become contaminated, including the material that was in that report, but site inspections, geological data, regional council data, that's all going on. And there could be a number of explanations for how these two bores have become contaminated, and we have no more specific information than that.
But you see, my point that I'm making is that bore number 3, you've had this long inquiry of several months, and it's inconclusive. So again, how hopeful are you that you're going to find out if they can't figure it out from that bore, what makes you think they're going to figure it out for the other two?
Well, I am hopeful, actually, for no other reason than a lot of resources are being thrown at this urgently to try and trace down what happened. The level of contamination in bore 3 was low and disappeared immediately, really. We are still having contamination a week on, effectively, in these bores. So every effort is being made with a lot of highly skilled staff and scientists to, as quickly as possible, eliminate things and try and get us closer to the source. And obviously everybody is interested in a DNA test this afternoon, as are we, for obvious reasons, and we will release that as soon as we have it.
If that report had come back sooner, it made a number of recommendations, even if it wasn't conclusive. If that report had come back sooner and not after this latest outbreak, do you think this could have been prevented?
No, I don't think it, no, I can't say that, because I know of a number of potential other possibilities that's caused this outbreak. If in fact, when we get the final analysis, it is this, what's in the Tonkin-Taylor report, that has caused the outbreak, then those questions can be asked then. At this stage, we have a completely open mind as to what has caused this, and there are a number of possibilities.
What are the other possibilities then? Because it seems to have two events so close together, so similar.
There's all sorts of possibilities. Floodwaters and drains, access through other wells. There's a lot of others, and they need to be systematically and scientifically gone through. And that's why I'm being careful about what I say about the Tonkin-Taylor report at this stage.
The fact that people were getting sick when that heavy weather event happened, does that change the way that things are being looked at?
Well, there's an obvious question in there, and that is we had a negative test on Tuesday when clearly people were getting sick. We can't explain that. It's an obvious question, and we need to look at that. But clearly, in the running of our whole entire network over time, when we've had a negative result, it has never resulted in something being found the following day.
Does that throw your testing processes into doubt?
Well, that's going to be looked at. It's just not explained at this point.
When you say the E. coli is still showing up in the bore, could that follow that then whatever's contaminating it is still going into it, or how does that work?
I think if that was the case, we would have found it by now. I think, it's possible if the groundwater source has been contaminated, then it's flushing itself. So it will take time for it. So what we've seen is a trending down in the numbers of E. coli, and we're at that sort of lower threshold now where sometimes it's there, sometimes it's not. So it's slowly flushing itself. And just to reinforce what Lawrence said before, the way that this contamination event is behaving is significantly different to what happened in bore number 3.
Given it's been more than a week now, you're estimating from when the contamination first started though, it must be a very large source for this still to be showing up more than a week on.
So what I'd say there is that when you have a rain event, obviously all of the land that is in that catchment, you end up with surface runoff. So just in a normal rain event, stormwater will have significant contaminant loads if it's draining off rural agricultural land, picking up those contaminants. So you have a significant source for the period of time that rain is there. So if that, once the rain stops, the water level drops down, then that contamination is reduced. But at that time, you have a significant source of contamination that if it got in for that period of time, it will have a significant effect.
Are there any other questions? There's one thing I just want to get Lawrence to clarify. The chlorine that was added on Friday after we found out, so the water would have been clear on Friday night, not Friday morning.
Yeah.
Oh, did I say
Yeah.
Friday morning?
Yeah.
Sorry, I meant it was clear through the system by 8 p.m. on Friday night.
How are you coping, Lawrence?
Well, you know, this has been the single biggest incident I've had to deal with in my mayoralty or my presidency of Local Government New Zealand. I take my roles very seriously, but and that being said, I lack a bit of sleep some nights, but I think, no, I'm physically fine. I actually, it's lucky because I actually haven't had the bug. I've had it previously, so I know how debilitating it is. But I feel for the people that have had the bug, and I'm trying to do all I can, once again, to make people safe and to make sure it doesn't happen again.
Have you spoken, or would you consider speaking to the family of the woman who died?
Yes, I will be speaking to the family of the woman that died. I haven't done so yet, and obviously I need to decide the right time based on the coroner's report. But clearly, whether it was the cause of death or not, this lady did have Campylobacter, and I feel an obligation to go and speak to her family.
And what would your message be to her?
I just want to, I suppose, share their sadness, say that, I guess, in some ways apologise that the situation has ended up like this. But once again, what I say will depend on what the coroner has found. As I say, the report that I've read this morning indicates she had a number of other underlying health effects. But no doubt she still had Campylobacter, and I will be meeting with the family at some point.
Okay, is that the end of everyone's questions? Thank you very much.
Thank you.
Thank you.